Just to highlight that in the private sector it is so fragmented because your surgeons are here, your gastros are here, your eye, your interventional, like it's just...
Yeah. Can I ask a question on that? Because clinical governance, you're all agreeing that, a similar experience, but how does that actually play out for you delivering care and also the patients? I'm just wondering, in terms of downstream, what does that mean?
So for me, I can only pick them up once they come to us medical oncology because I don't have scope being 0.6. So I only get to support the patient from when they land on my doorstep.
There's also outpatient, inpatient.
Yeah.
Because people are sitting in outpatient, inpatient services for the same thing in different ways, and it's confusing who owns it, and that's with hard with referral and when can I start doing stuff, but has someone passed the ball on? So working out how you optimise referrals so it's transparent to everyone know what's happening. And then I suddenly think, right, is there a technological solution to that? Do we need a place where we all see who's referred and what's happened?
The investigations and that pathway to investigations, it averages about 3 months to go through those lung cancer diagnostic investigations. So it depends on the number of bronchoscopies and, number of nurses to be able to support patients to actually improve those appointments and the wait times and all of that. So to influence that change and improve those outcomes and improve that access to care more quickly, it can be a really impossible task.
Well, I think just the increasing complexities of our patients now. It's like having a cancer diagnosis is a chronic disease, it can be, depending.
Yeah.
And so you've got multiple diagnoses of multiple kinds of specialties, plus their social situation. Where do they live? Do they have an address? Are they homeless? So many variants. It's just not a hard and fast, simple pathway to follow.
Is MDTs in the cancer landscape universal, or
It's not good in the private sector.
They're not just an MDT when there's a learning component to it and there's challenge and there's discussion.
Yeah.
And just for nurses to go and listen and learn gets them ready for the future.
Yeah.
But we just doubled our size of it, slightly different to an MDT, but we had more doctors coming and just more stakeholders in the room, greater discussion, greater learning, greater collaboration, greater consultation, changing culture. And that cultural shift is amazing.
Yeah.
And I'm challenging because I can't bring nurses to it because they're all busy working. But if they were in there seeing that, they'd be like learning about all the tumour lines, learning about everything.
To now, we're increasing self-advocacy for patients and involving them in shared decision-making. I just think the movement towards telehealth as an adjunct to face-to-face nursing, I think it's a great move as well. I think there's a lot of support that telehealth can support unmet needs of patients across the pathway. And lastly, the advanced practice of specialist nurses being recognised more, being able to advocate for patients and being a respected mentor and support for junior staff to help upskill for a future workforce.
Oncology and cancer care, nurses weren't included. And when you got invited, that first invite was special. I've sat, in a lot of MDTs now, and I think the nurses are valued. Their opinions are valued. The patients get the more specialised support rather than with specialist nurses. They'll get that specialist support. That's a positive for a patient. Health services and government seeing the need for specialist nurses rather than just RNs. Yeah.
Then we've got all our notes integrated, and then we also have feeds coming in from our inpatient notes from Cerner, and you've got a comprehensive record. I can't believe people work any different now after the benefit of that. And I've been thinking a lot about how will these other roles document and where will we find what the plan is. And then I think about how, and I talk to my GP friends who don't want to play in the sandpit with everyone, but talk about how they don't know anything about the patients. And for me, I know everything. And I'm just like, that everyone should have that. We need to have a system so integrated so you see everything. And I keep thinking the My Health record is that it sits there, it's not optimised, it's not being used, people aren't pushing the documents to it, it's designed to be a repository for. but when they're there,
Yeah.
it works so well for the patient.
We've got to get cancer nursing documentation the same for all the cancers, because I know the cancers are different, but they're not that different. I don't know, it just feels like that's the big opportunity.
My hope for the McGrath Model of Care is that we're actually getting one of the first release care coordinators to Sunshine Coast Hospital and Health Service, and that's going to really help close the gap in the inequities of care for our rural and regional patients. So that'll be really great.